You're listening to episode 169, Dr. Kelly Fradin, Building Trusted Relationships with Your Child's Physicians. Hello, my friends. Welcome to Child Life on Call. This podcast is a safe place for parents to share their stories about what it's like to have a child that has a medical experience, diagnosis, disease, and or everything in between. We know there's power in sharing stories, and that power multiplies when you can listen to other parents who have walked a similar path to yours. Giving and getting advice is great, but hearing how another parent navigates the complexities and nuances of healthcare is even better. As a child life specialist, my role is to support, validate, and provide emotionally safe spaces for kids and their families, and I am so honored to be on this journey with you. In addition to parent stories, we sprinkle in some expert episodes every now and again that have content for both parents and professionals in the field of healthcare, all with the mission to empower parents to be confident advocates and partners with the care team during healthcare experiences. We're so glad you're here. Hello, my friends. I have another fantastic interview for you today. So again, a different break from our normal parent stories and interviewing the people who take care of our families at the heart of it all, which are our physicians and pediatricians. And I've got Serheen as my co-host today, and I just absolutely love having her here. So Dr. Kelly Fradin is a graduate of Harvard College. I don't know if you've heard of that. Yeah, it seems like pretty prestigious as far as I know. I read about it in a book one time. A graduate of Harvard College and Columbia College of Physicians and Surgeons, and she is now a pediatrician and mother of two from New York City. She is the director of pediatrics at the Atria Institute in New York, which is this totally new way to do pediatrician office visits. And the Atria Institute is where she works with leading experts to bring innovations in preventative care to their members in underserved populations in New York City. So in addition to this wonderfulness that we get to hear from Dr. Kelly Fradin, we also have Serheen Noor Ali, and she is the co-founder of Hello Sleuth, which is a place that every parent needs to go to when their child is ill and you are Googling symptoms. You can Google symptoms, of course. We know that people will do that regardless of what recommendations are given. But when you go to Hello Sleuth, then you can actually see what other parents are saying about their child's symptoms and get really trusted, amazing information in this incredible data algorithm that my brain cannot even understand. So you can go to hellosleuth.com for that. All right, let's get started with our conversation. Before we jump into the episode, I wanted to let you guys know that if you are a parent, a child life specialist, or professional working with children, you're going to want the hospital or physician's office or urgent care that you take your kids to have the Child Life On Call app. It is an evidence-based tool designed to empower children and families during medical experiences. And 100% of the child life specialists who have used this app believe that it can help with expanding child life's reach beyond the bedside. And 100% of child life specialists believe it helps parents feel more empowered in their child's care. Learn how to get the Child Life On Call app for your facility or doctor's office by going to childlifeoncall.com/partners.
We are so excited today to have Dr. Kelly Fradin with us. Dr. Fradin is someone that I came across during COVID, and I know so many other parents did too, about like, how do we help our kids? And so you might know her as Advice I Give My Friends. She is a graduate of Harvard College and Columbia College of Physicians and Surgeons, and she's a practicing pediatrician and mother of two in New York City. One of the things I love about your bio, Dr. Fradin, is also that you spend a lot of time in public health. And I'm sure you'll touch on that. And something that's, I think, close to all of our hearts is that you were a pediatric patient yourself. And so you come to your experience and expertise as a pediatrician with just a lot of lived experience and a lot of empathy for what the child might be going through. So thank you for being here. And please tell us in your own words who you are and what your work is.
Yeah, I mean, that pretty much sums it up. I would say that I kind of always wanted to be a pediatrician. And one of the things that is a little unique about my background is that I've focused on supporting kids who have chronic medical conditions, in different settings. So I used to work in a hospital-based academic complex care practice where it was like seeing them in the clinic and the ER and the intensive care unit and really getting to know the family as well. And then I was working for the public school system in the South Bronx, seeing how these children with these chronic conditions interfaced with their school systems and fell through the cracks sometimes in their communities because systems aren't always set up to accommodate their needs. And now I'm in a private practice, which is a different environment from where I've worked before, but still thinking about how best to advocate for these children and their families by sharing information and resources and just shining a light on what their experiences are.
Well, we're so thrilled to have you here. As a child life specialist, I love getting behind pediatrician, physicians, and providers that really get the parent experience and how when you're treating a child, you are really also co-treating the parent and the rest of the family members too. And so one of the first things I'm interested in is just kind of your path to what that moment was for you when you were like, I think I'm going to step outside what I'm normally doing, or maybe what I thought I would be doing as a pediatrician, and make resources more accessible to families through your Instagram and your books. What moment was that for you when you thought, okay, I'm going to go down this other path as well?
Yeah, I guess it has to do with like the barriers my patients were encountering, right? So when I was working in the complex care practice, I at an academic center, I had a lot of time with my families and very close relationships. And I would really like give them everything that I could to set them up to have success managing their condition in their homes and their communities. But it wasn't like enough because I didn't know what they were facing at the school level, or I didn't know the issues they had with their housing or with their parents' job flexibility. And it was sort of an awareness that the conventional doctor parent relationship in the clinic, it has limitations that led me to want to kind of take a risk and do things differently and start sharing information in other streams and also working in other streams to see like whether I could make an impact at helping the systems to improve.
I mean, it feels like the pandemic was this perfect storm for like just better information. Like, what were you surprised by when you started putting things out in the world that you were hearing from parents that maybe the mode of social media gave you access to that was different than the consult room or not? Like, it's just so interesting to me how you all filled this void, but we didn't talk about that void pre-pandemic. Like, parents have always wanted kind of a more of a touch point to understand their child's health.
Yeah. Well, I think there's a lot of it's really a hard thing to do well, to share information about children's health on the internet, because you obviously like don't know everything about the people consuming the information. And so I think I didn't realize how hard it would be to kind of thread the needle, because particularly what you want to do is not make people more anxious or add more to their plate about what they should be doing or what they should be buying or how they should be making their meals. Or like, you don't want to share information in a way that will make their lives harder. You want to share information in a way that will make their lives easier, increase their confidence, increase their independence in feeling like they can take care of their children. And so to do that, you really have to like connect with and know the audience receiving your message, because otherwise, you have to make too many assumptions about who's on the other end of the content. I sort of thought, it's silly in hindsight, but I sort of thought when I started, I was doing a lot of public health work in the Bronx. And I was like, maybe someone in the Bronx will read my content. I don't think anyone in the Bronx reads my content, which is fine. But like, I do think there's need everywhere for better and more information. And so, you just kind of put it out there and then see who's finding it the most useful and get to know your audience that way.
Mm. Yeah, I love that. And I feel that completely too, on a very much my smaller scale of what your audience is. It's that concise information, right? That doesn't feel overwhelming when you're consuming it, because so much of the other things do feel really overwhelming. And also, when you're talking with a parent in the clinic, I felt this as a parent myself, Serheen, I'm sure you have too. It's really easy for me to be so concerned about what I am upset about that I'm not really hearing what you're providing to me. And if I can go home and on my own time really process, and I can go back to your page, repeatedly reading the same thing over and over, it's not just 15 minutes that I get with you anymore. I kind of get access to what you believe in, what you support, what you think more often on my own time when I can consume it on social media.
Yeah, and that's exactly how I am about consuming information as well. And it's funny because when I was writing, so I have this new book, right, Advanced Parenting, about how to support your child in a challenge. And when I was writing it, I got some feedback from the publishing team that it was maybe dense. And it's like it has like a ton of information about different stages in your challenge because of that awareness that like some chapters might resonate with people at certain times, whereas like later or in a different moment of their parenting journey, there might be other pieces of it that they're more focused on. And so the awareness that like you can consume content in a way that makes most sense to you as a parent is, you provide the information and then empower the reader to find what they want.
It reminds me, yes, so much of like as child life specialists, like visual, auditory, sensory experiences. We have to give so much information for their little minds to understand what's going on. So I totally relate to what you're saying.
Yeah. And also because like you're, depending on where you are in the journey, like it's like a hard turn. Like the information you need from 0 to 18 is like all over the internet. And then as soon as you have something that's atypical, it's like, well, where's the information? But when you're going through that journey, sometimes the you might not have you might be looking for additional providers. Like some of the advice that we hear on the podcast from other parents is that it's important to trust your provider and that it's okay to break up with someone who you feel like might not be a match. What qualities do you recommend that parents should look for in providers that can help them feel like they're part of the team, not just, kind of a separate entity altogether?
Yes. I think it comes up a lot that families pick somebody at the beginning of their journey, maybe based on who's covered by their insurance or who's physically the closest to their home or whatnot, and then discover that other factors are more urgent to address. So, I think having someone that you can be honest with is really important. Like I've heard from a lot of parents who feel like judged or like they can't tell their pediatrician certain things. We actually know, unfortunately, that half of parents lie to their pediatrician about things like safe sleep in infancy, like even from like the first couple months of life. Like if a pediatrician asks you if the child's sleeping in the crib, you're like, yeah, sleeping in the crib. And like real world, like you're not having your child sleep in the crib, they're in the bed with you. And so I think it's important to have, if you can't be honest with your doctor, then they can't give you the best advice. And so also like, if you can't be honest, maybe it's for a reason and you feel like they're judging you or making you feel less capable or whatever it is, but like, that's not a healthy relationship to continue. So if you need to move on to find somebody you feel like you can trust and you can talk to and you can be honest with or vulnerable with, then the switch is worth doing. And I think people are so nice, generally speaking, to their pediatricians. You shouldn't feel like you have to stay with somebody for them. Like all your pediatrician wants is what's best for you and your family. And so even if it's maybe going to a different practice that better suits your needs, like that's what you should do.
Is there like a how-to? Like, do you need to like close some files, transfer some files, send a note? Like, do you do an Irish goodbye? Like, what's like a good protocol for this?
Well, what I do recommend is that you find the new person first and see
Oh,
them
okay.
use it, because otherwise, like, what if you break up with your pediatrician and then you go and it's not all you hoped it might be? this highly recommended alternative doctor. So before you break up with your pediatrician, find the new one and confirm that they're a good fit. I don't think you have to say anything. You probably do want to request your records from the office. You can say something or write a note especially if you feel like it might help other patients in the practice, to say like, look, I really enjoyed working with you, but I had to find an alternative practice that did X, Y, or Z for my family. And I wish you the best.
Yeah.
Kind of
Yeah.
thing. 'Cause that in some ways is like a gift, because maybe a pediatrician gets one or two of those notes and then they say, maybe my nurse needs I need another nurse to answer the phone when patients need prior auths or imaging referrals or things like this. And they may make changes to their practice to better meet the needs of the patients there if they get that feedback.
Yeah.
That leads me to the next question I was thinking, which is, when you go to see the pediatrician, so much is put on your shoulders of how the entire experience is, but you're really just kind of a small part of what we go through as parents when we bring our kids in. And we could have a terrible vaccination or a bad blood draw or a nurse who doesn't introduce themselves. How can we explain that to our pediatrician, right? Because it's kind of the last thing we want to talk about when we see you. We have our questions, we want to listen to you. Who is that person in a pediatrician's office that you can share that feedback with and not feel like an overbearing or helicopter parent?
Yeah, it's interesting. Unfortunately, I think it's going to vary a lot depending on the structure of the practice. Some people, the front desk person is actually the practice manager and a great person to talk to or give feedback to. In other practices, that person is maybe a temp who's just like answering the phones and doing back office work, and won't be the right person. So I think it's one thing that people don't always take the time to do when you are working with an office long term, to get to know a little bit about how the office works, like who does what and who do I talk to if I need this or that. And what if a question comes up after the visit? Is it email or phone or a portal message, or how do I navigate this place that I'm now receiving care? These are important questions, and hopefully they're done that they anticipate that you'll need this information and give it to you at the beginning. But often we also see that like maybe one parent goes to the first visit and it's the other parent who has the follow-up questions and didn't hear all that spiel, or maybe it was a year ago and you forgot, and now it comes up again. And so there's definitely a lot of barriers to knowing the office in the way that you need to.
You guys should see Serheen and I. We're like, we have so
I
many
know.
questions. We're just like
so many
chomping at the bit.
Well, I heard a story last week when we were doing user testing for Sleuth from a mom who found a pediatrician that was recommended, had like tons of great reviews, but essentially what she found was that pediatrician was really good for younger kids, but perhaps had less specialty for her 13-year-old. And given how much variation there is from 0 to 18, like what are the change points? Like I can imagine that what our needs might change also, but how do you anticipate that when you've never had anyone older than your oldest child, right? Like, is that common to kind of find different pediatricians for different age groups?
It's not very common. I think anytime you transition your child's care, that there is a loss of information, even if the records come over, even if there's perfect communication in the transition, there's still like, when you're taking care of a child for years and a family for years, you know them generally as a pediatrician.
Yeah.
And so also your child in the teenage years has to become more independent in their interfacing with the doctor. We try to transition them to being an adult by the time they graduate. And so we want to make sure the child is comfortable in that relationship. And often the years, like 6 to 12 are years when, the child remembers me. And then when they're 13 and up and they might be coming alone, it's like they have this familiarity and it'll be a more comfortable space for them to practice some of these new skills. But that said, like in that transition to the child being the driver of the care, you can also listen to your child, and perhaps, perhaps your child has gender preferences about their doctor and wants to talk only to a doctor of the same gender, or only to a different gender doctor, or whatever it is. Or perhaps the child doesn't like the doctor and finds them intimidating or mean or something. And so I think changing for your child's preferences is a valid reason to change as well. And certainly there are, I work really closely with an adolescent medicine specialist, Dr. Hina Talib. And the adolescent medicine field is relatively small, so not every community might have an adolescent medicine specialist. But if you're in an area where you do, and your child has some potentially more teenage specific issues that you want to address, you might consider adding that specialty in as another layer, or transitioning to an adolescent medicine specialist. So things like gynecologic needs like painful periods, or problems with puberty and growth. They have extra also interest in children who have substance abuse or behavioral health conditions. So anything teenagery like that might, sometimes you can find other providers to meet those needs, but also adolescent specialists, pediatricians have a lot of value to offer.
Because I don't know that a lot of people know that adolescent medicine is actually a specialty, and something that you can start to investigate on your own as your child gets into the older school age years. And I love that advice too about just listening to your child. And that's one of the things when we prepare for a well woman visit, or we talk to parents about how to prepare their own child, is get their insight on who they want, what they want to discuss. Do they want you in the room? Do they not? Do they want an extra nurse? Just those preferences. So you mentioned your partner, and I know I would love to learn more about what you're doing at your practice, and what your vision is. And I want to pronounce it right. Is it the Atria Institute?
Yes. So Atria is really cool. It's basically a preventive care institute in New York City. And so we have like a think tank arm called the Academy of Science and Medicine, where we have a lot of leaders in different fields with the goal of making the transmission of good information about health more democratic and accessible, rather than like having it stuck in the ivory tower of journals. And then we have like another nonprofit arm called the Health Collaborative, where we hope to invest in projects to better promote underserved communities and accessing best practices. And then we have just a primary care practice, and it's a direct primary care practice, so it's small and it's outside of the insurance network. So it's been a different experience for me, but it's been a really fun project. And I'm excited to see where it goes. It's new. It's only a year in, so we'll see.
That's amazing. So where in New York City is it, and what patients do you accept to come?
Yeah, so we have babies to geriatrics for primary care, and we're located in Midtown. And I have to tell you, when we also have an imaging center, and so Child Life was one of the first people I contacted when I was getting everything set up, because when you bring in, I think pediatricians are from academic medical centers in particular are kind of like spoiled by having access to Child Life. But when you're training a new group of providers, including people who maybe took care of mostly adults in their background, or radiology technicians, where they might not have as much familiarity in working with different ages, it's like, how do we help them gain skills in being child oriented and child friendly? So we did collaborate with somebody here to help with that.
I love that.
Oh, I love that your experience, you have such a breadth of experience of like different types of families and patients and locations. But I'm wondering if there's any similarities between like how parents feel. Like what is like life like for you? We know what life is like for parents going to pediatricians, but like what don't we know about what it's like to practice as a pediatrician, that you want us to know? I know one thing that I hear a lot, and I think we talked about this too, that parents are in the driver's seat. Like a lot of parents don't know that? Like, what would you say we should keep in mind as we're navigating our child's care, no matter what our background is?
Yes. I do think that parents have a lot more power in terms of what they get out of going to the doctor than they realize. So, I think that once you're in the room with the doctor, you really can drive the conversation in a way that best suits you. Whether it's saying that like what your goals of the visit are or why you're there today, and what you hope to accomplish before you leave. And you can really recenter the attention of the doctor on what your priorities are. And not only can you do that, it's like you should do that, right? Because otherwise you just leave without getting what you need. And so it may be that what you need is for the doctor to tell you what to do and to tell you what to be thinking about. And that's like a valid goal too. I'm not to say that you have to do the doctor's job for them, but if there are concerns that are top of mind for you about your child's mental health or school performance or learning or development or whatever it is, to really make sure at the beginning of the visit that those priorities are clear, will then result in you getting the better care from the doctor.
I have a question that I think I know the answer to, but how much time do most doctors have to read the charts before an appointment?
That's a great
Because
question.
we assume that like I feel like I assume that my doctors might know more about what's going on than they might than they might actually be updated on. And that's important for me because then I know how to do the first part of the appointment. Like I'm sympathetic to it. I'm not upset about it, but it's like then I know what to do as soon as they walk in the room.
Yes. I think it's highly variable. Some doctors, I would say most doctors prep in some way, but what that means to you versus to them might be different, right? So maybe they, before the visit, reviewed your child's vaccinations and preloaded the orders for what you're due for. That's maybe not what you thought about. Like maybe they didn't go through and read all the sick visit notes you've had this year. I think the other common thing is that if they have you do like a screening form right before your visit or right before you walk in, those often go through like layers of the office to get like scored and uploaded, and your doctor may or may not have seen those by the time that the visit occurs. So it depends a lot on how the practice is set up. Very variable.
Yeah, because there's a lot of assumptions, right? Like especially if you're checking in on My Connect or something and you have a screener, I think the default assumption is that it goes directly to your doctor. So that's really helpful to know because I think the risk of that is then, okay, I don't want to repeat myself in front of my doctor, going back to your point that sometimes parents are intimidated in front of their pediatrician. So they don't want to be disrespectful by saying something that maybe they think they've already shared. So there's obviously not always a connection between like the systems and then the actual visit when you get to be in front of a pediatrician. It's very helpful.
And I love what you said, Dr. Fradin, about the getting it out at the beginning, like what your goals are, because otherwise you're going to sit there through the whole visit thinking about the one thing you wanted to talk about and not hear, 80% of what was going on. So I think that's really good advice and a good question too, Serheen, right? I don't think I've ever thought about that. I don't know if I assumed you just got an alert to your phone that told you everything you needed to know about my child before you walked in the door. No, that's not how that works.
Yeah, but one thing that's relevant to your child life expertise is that that often parents don't tell you, as the pediatrician, like we don't always have a heads up if your child is needle phobic or is traumatized by prior experiences with needles and vaccines and blood draws and stuff like that. And it makes it, being reactive once that is apparent is never as successful as knowing in advance. So I do think that that being honest about it because I do think it's frustrating for some parents that like accept that maybe their child is really just having a very hard time with vaccines, and it's very like it's going to be a struggle, and they don't maybe want to deal with that, but it has to be dealt with, right? And if we just ignore it, then we won't do as good a job, and then it'll just make it worse the next time. And so please tell us in advance if possible, so that we can help you prepare your child. It's funny because when the COVID vaccine came out, I was doing like a lot of favors for families and friends who wanted to access the vaccine and couldn't find it in other places. And it took me like a month or two to realize that the people who are coming to me were mostly coming to me because they didn't feel like they could take their child to a drugstore because they had a needle phobic child, but they didn't want to tell me, like, they didn't want to ask me the favor, will you vaccinate my child? And by the way, my child is severely needle phobic.
Yeah.
It's like show up in my house or my office, and then it would be like, oh, okay, so that's why you wanted me to do this.
Yes.
Well, one, like, we don't judge, right? Like, children have the reactions they have and their feelings are valid, and it's not like you can always parent your way out of that. Sometimes it's just the reality of how your child processes stimuli, right?
Yeah.
Oh my
So
God, it's so powerful. You
Yeah.
can't parent your way out of it. I feel like that line is so liberating.
Mm.
yeah, like,
That's so liberating. I'm like processing what you're saying. I'm a medical needs parent. And, I feel like you have all this control over their reaction, but sometimes it just is what it is.
some children are, some children are more sensitive than other children. Um, but I'm sure you've talked about this in other episodes, but there are like a lot of tools that we can use to help kids prepare and make these procedures more successful and gain their trust. But they do take often a little bit of preparation in advance and a little bit of
Yeah.
communication about what the plan is. Um, because the thing that can make it worse is if you prolong the time before the procedure in the office, and you can see the kid getting more and more worked up or anxious.
Anxious. Yeah.
So it's really hard to deal with on the fly or in the moment. So I would always encourage parents to be honest and prep for it. Prep the staff, let the front desk know that, like, coming in
Yeah.
hot.
Yeah, I think a little message on the portal just to the practice manager or the doctor, and then you can give it to who needs to know ahead of time. And yeah, we have another episode that how to prepare your child for shots. And I was on another podcast where we talked about it, Peds Doc Talk, kind of about the whole how to prepare your child for shots issue, because it is important, and it is so much of their experience, ages 0 to 7, coming in for shots almost every time you see the doctor. I know we don't have a ton of time left, and I want to hear some child life stories from you, just some of your personal and professional experience. But my last question is, as a child life specialist, when I know that a family has to come in for repeat blood draws, whether it's for human growth hormone or whatever the issue may be, some sort of treatment, we tell parents to start talking to their doctor about some sort of numbing cream or some sort of option for topical anesthetic that could perhaps lessen some anxiety. Is that appropriate for us to be suggesting? And when you hear that from parents, I'm sure that kind of opens up a bigger communication about what's going on with them and how they're coping.
Yes, I think it's really great to use tools to reduce children's pain during these procedures. I mean, so we have the Buzzy Bee, and we've got the cold spray, and we've got the lidocaine cream, and we actually offer it to all our patients because I think that it makes a big difference. And the sad thing is there are barriers to it, because the numbing cream takes 15 minutes or so to work. And so the problem is that the blood drawer has to have a say about where the blood is drawn from, right? And so you have to put the cream in the right spot 15 minutes before the visit. And so it can be kind of messy. You typically cover it with like a Tegaderm or a plastic Band-Aid to keep it in the spot for 15 minutes. But so if you have an office that's willing to do it, you have to figure out where you're going to put it and make sure that whoever's drawing the blood will feel comfortable with that, with you picking the spots and whatnot. So it's not so straightforward, unfortunately. I do think that it makes a difference. The other modalities are not as effective, right? They might help a little, but they won't help as much as the numbing cream. But sometimes they help in terms of, it's kind of like a placebo effect, that like the child feels like they had control or they had an option, like
Yeah.
frankly, I don't think the cold spray does much, but like some kids like it. And if it makes them feel better and it makes them feel like, well, I won't do it unless you have the cold spray. I'm like, okay, well, I have the cold spray. It's like, okay. That has power in its own way.
I love how you were like, yeah, we offer it to all of our patients. It just is what it is. And yeah, I totally understand it's a tech preference or a nurse preference on where they go. And so we tell families to put it on a few different spots of where most likely it happens and to practice ahead of time. So do a practice numbing spot at home so you know that it works. You gain trust. Is it 15, 30 minutes? Don't expect that the first time we put it on it's going to go exactly right. So all of those are just little tips to really empower families.
Yeah. And I think the other important thing, I'm sure you've said this before, is like not to lie to your child about the fact that it still might hurt.
Yeah.
Like the squeezy part on the arm, even if, you can't numb that really, and that's uncomfortable. And then you might not feel as much pain when the needle goes in, but you can still feel it under the surface sometimes.
Yeah.
And it's, when you set the expectation that it's going to help, but it's not magic. It sometimes is better because you're maintaining the trust.
Totally agree. Totally agree. Well, Dr. Fradin, I would just love to hear just a little something about your experience with child life, or maybe an interaction that really kind of you understood what child life role is. We're constantly advocating for ourselves and for families in healthcare. So it's really selfish of me to ask this question, like, what do you like about us? But it really helps when other child life specialists can hear from someone like you in such an esteemed position.
Oh gosh, child life has made such a big impact in the lives of my patients. I really take it for granted, like the imaging centers, like the MRI prep work that they do on the site when there's a child life specialist working in those, it can make a huge difference about what the experience is for the child. And the same with like some of the surgery centers, especially our local ENT surgeon. They have child life prep every patient before they go in, and they like draw on the mask with the nice smelling lip gloss and make the child a little bit less scared in that setting. And I think it provides a lot of comfort to the parent as well to know that the child has been prepped. But my complex care practice was probably the time when the child life made the biggest difference, because I had a lot of children who had technologies that they were reliant on, either G tubes or tracheostomy tubes, and those children had to go through procedures frequently, right? To have them changed or cleaned or adjusted and all this stuff. And sometimes the parents have to do that at home on their own. And so to go from the point of like learning those skills often in the hospital, under pressure, because as soon as you learn them, you might be allowed to go home. So to go from like learning the skills to mastering those skills, and then to being comfortable with those skills, like the comfort piece is often where a child life has made the biggest difference, right? Because it's about, the whole approach to prepping the environment, right? Thinking about getting an iPad for your child and putting on whatever, and making a plan for like where you're going to keep your stuff so there's no surprises, and talking through it. I can't tell you like how important it has been for families to have that support. Um, because even if it has nothing to do with the actual like doing of the procedure, that's not, for most parents, that's not actually the hard part, like the doing of the thing. The hard part is the whole scene, getting the child to get there, calming the child after, helping the child tolerate it, and making sure it's safe. And I think that it should really be, in my opinion, like nurses often teach and do an excellent job teaching the parents the skill of doing the procedure. But in my opinion, the child life piece of it should just be like part of the educational process for it, because it has such a big impact on the child's
Mm.
experience.
Well, thank you for saying that. Yeah, our mission, and I tell Serene this all the time, I want every family to have access to child life services, for those complex procedures, empower parents so they feel like they know how to read the situation too and get support whenever they need to. So I really appreciate that. And your time today. I would love for you to tell people where they can go pre-order your book and find more of your resources. So where's the best place for people to get in touch?
Oh, yeah, I'm probably easiest to find on Instagram at the advice I give my friends. Also on Facebook under the same thing. And I have a website. It's kellyfradinmd.com. So you can find me there. And the book hopefully should be everywhere, like Amazon and Barnes and Noble and wherever books are sold, advanced parenting. So I'm excited.
Yay. I'm sure your friends are like, why are you giving? No, I'm your friend, Kelly. You need to give me the advice. Now you're giving it to everybody. So you have to give them special advice then, right? That the rest of us don't get.
Yes, yes. I'll give you advice for free, and then I will also share it with my 40,000 Instagram friends.
They're your early adopters.
Exactly. They're the beta testers for your advice.
Yeah, exactly.
Well, thank you so much. Yeah, Dr. Fradin and Serene for joining us. Love having you here. And just go order her book. It's Advanced Parenting and Advice I Give My Friends on Instagram. Thank you all so much for listening to Child Life on Call. If you head to our website, childlifeoncall.com, you're going to find all sorts of stuff there for parents, professionals, healthcare providers, child life specialists, no matter who you are. Actually, when you just go to our homepage, it'll help you direct to exactly where you need to go. On that, you'll find opportunities and PDUs for child life specialists, parents. We've got a starter kit for you. And clinicians, we even have a clinician course, which teaches you how to be a confident and capable caregiver in pediatrics. We're so grateful that you're here. Please DM us on Instagram. And like I mentioned, when you rate and review this podcast, it helps other families be able to find us. So let's keep doing that. And I will see you again here next week.